Hi guys, it's Dr. Selene here with BU Medical. I want to talk to you about a procedure that I love, and it's called the Profound. It has its limitations, which I'm going to talk to you about, and I'm going to talk to you about my own journey doing Profound. So Profound is basically like microneedling on steroids. So it's needles that get placed deep into the skin with radiofrequency that goes deep into the tissue. I ordered this machine long ago, about a year ago, because what I was noticing was that I was falling in the lower part of my face, and some of my clients were starting to sag in the lower part. The issue came in that even though I love Botox and fillers, you can only fill the upper face so much without getting very cheeky. And so that cheeky look has this classic appearance of looking done. And that's never something that we really strive for in our clinic, and I wanted the more natural look. In addition, I also wanted to address the root of the problem, which the root of this problem, which is loss of elastin, collagen, hyaluronic acid. Fillers are fabulous, you know we love them, but the thing is that they are our Band-Aid. So are they really lifting? Possibly a little bit, and some people would say they don't even lift at all. They're just kind of camouflaging and causing a visual aesthetic that causes things not to look as deflated. So think of fillers more as volumizers, but not really lifting, even though we hope that putting a little bit of filler in the cheek will lift this bottom part of the face. You're only asking it to do so much. Remember, each syringe of filler is only 1/5 of a teaspoon, so putting 1/5 of a teaspoon spread out throughout the cheeks can only do so much lifting. So when I do a consultation and somebody says, I want this, I say that's probably more of a facelift or a deeper laser treatment. So if you're heading towards a facelift, I always say go for it. But if you're thinking you want something non-surgical and less invasive, this is a great option. It does hurt a little bit. I'm going to walk you through the process. The way we do it is we have you numb up the face before you come in. It typically treats from the upper cheek to the lower neck area. So it does not typically treat eyes up, but it's really geared towards jowls and neck and lower neck area. So what we do is we have you numb up that area with topical numbing. We can give you a pain pill or a relaxation pill if you'd like, just to make it an easy process for you. And then the nurse will get the area anesthetized by injecting some lidocaine into the area. That makes you look like a little squirrel, super chubby, super swollen, but that is the hard part of the procedure. It really is just those first 5 minutes getting through that, and the rest is easy breezy, because remember that you're fully numbed the rest of the time. Where it really hurts with the injections is closer to the mouth area, where the nurse will inject you in this area, and then it eases up as she goes out. And then typically the neck is a really easy area to treat, so don't worry. They typically start with the hardest part first. Once you get through that, you're all numbed up and you're good to go. Remember, that's only 5 minutes, so you can do it. After that, what she does is she puts the probe onto the Profound machine. That gets placed onto the skin. You're gonna hear like a clicking sound. It almost like sounds like a big stapler going off, and that allows the needles to engage into the skin. Your nurse practitioner or nurse will make sure that the needles are buried into the skin to a point where we can't see them, and that make sure they're fully buried in, and then she'll put the energy in, and you'll hear a little beeping sound in the background. You'll hear it go off, and you'll hear that energy getting delivered, but you will not feel pain. So you need to know during these moments, this is all causing that lift to go up. The nurse will then proceed per protocol to put so many lines and so many injections with the needles throughout the cheeks, upper neck, and lower neck, depending on what you choose to do. So that gives you the results that you're going to eventually get. Your results are not for 3 to 6 months, so don't anticipate them within the week, don't anticipate them within the month. You may see a little bit of slight lifting. My first thing I noticed was the hyaluronic acid content in my skin really improved. So that's what gives you glow. So that's what I would say really I noticed a big difference on. And then the second thing that I feel that I noticed was improvement in my elastin. Elastin meaning one of those things that when you get crepey skin as we age, your skin just doesn't bounce back. Think about kissing the cheek of like a 2-year-old. When you kiss them, it just bounces right back at you. And that's what happened with my cheeks. I could feel that I had much more bounce back. And this guy improves elastin by up to 6 times what it originally was. Remember, these are all scientific based. So if we were to do a biopsy before your treatment and a biopsy after 6 months of your treatment, we actually would see an increase in elastin, collagen, and hyaluronic acid. The one thing I do tell people is make sure that you're the right candidate. Our consultants will walk you through this and see if you are the right candidate. I always say, have a positive attitude about this. If filler doesn't work, Botox doesn't work, nothing has worked, this isn't gonna work either. So you gotta walk into this with a really positive attitude. And even if you don't see the most dramatic changes or dramatic lifting, it's fantastic for your skin and for your rebound and long-term health. So even if we see pictures and we do review your pictures at 3 to 6 months and we're like, they're okay, we'll keep an eye on that. We can always repeat the treatment, but typically this is a one-time treatment. So that's fantastic news for everybody. And I always say one time, although I would say most people, we recommend to repeat it 3 to 10 years after that. Recovery process after the initial treatment is a little bit of swelling from all that numbing that we put and some bruising from that as well. That's typically only lasts you about 3 days. Being that we were in a COVID world when I did my treatment, I just covered up with a mask and went to work the next day. Literally nobody could tell what I did with a high neck shirt and a mask, so it was no problem at all. And again, I've seen results from what I initially did already in my before and afters. It did take for me to look at the pictures to really notice the dramatic results because we get used to seeing our face every day and you may not see those little subtle changes that improve. But I can honestly say I do think I look a little bit younger this year than I did a year ago when I initially did it, which is always the goal. The goal is kind of to put the brakes on the aging process to slow it, if not even halt it. So that's always good news. And remember, as we age, there's different modalities we want to use. This is typically a modality that we use for our 30+ crowd, are people who've lost elastin and collagen, and it helps significantly with wrinkles as well. We will also recommend a CO2 treatment for people that are eligible. On top of that, I'll talk about that in another video, but that helps resurface the top layers of the skin, and the double whammy is amazing. So if you have any questions about this, we're here to answer anything that you want to see if you're a great candidate, if there's other options that are available for you. Remember, we want you guys to look great so you can feel great, so you can do great things in this world. Take care, guys. Bye-bye.